Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 72100 radiologic examination, spine, lumbosacral, 2 or 3 views X-ray showing up to 3 views of the lower back or lumbosacral spine. 72110 radiologic examination, spine, lumbosacral, minimum of 4 views, X-ray showing 4 views of the low back lumbosacral spine. 72114 radiologic examination, spine, lumbosacral, complete, including bending views, a minimum of 6 views X-ray showing up to 6 views of the low back lumbosacral spine. 72120 radiologic examination, spine, lumbosacral, bending views only, 2 or 3 views, X-ray showing up to 3 views of the low back, lumbosacral spine. 2 to 3 films are taken of the lumbar spine or lower back, with the patient bending to demonstrate the mobility of the intervertebral joints. Although CPT 721007 and CPT 72120 both involve 2 to 3 views of the lumbosacral spine, the critical difference lies in how the images are taken and why. Use 72100 when the images are taken in a neutral position. This includes standard AP, lateral, and/or oblique views with the patient standing or lying still. This is the default for most routine spine evaluations. Use 72120 when the images are taken with intentional motion, such as flexion, extension, or side bending views, to assess spinal mobility, instability, or post-surgical fusion status. Important: check your facility or organization's coding policy or radiology protocol for how they define and differentiate between these two codes. Some institutions may bundle certain views differently or have unique documentation requirements. These views are used to evaluate the lumbar spine and adjacent structures. The number and type of views directly affect CPT code selection. Lumbar spine AP or PA view, lumbar spine PA Ferguson method, lumbar spine lateral view, lumbar spine lateral flexion extension views, lumbar spine AP oblique views, lumbosacral junction lateral view, L5S1 spot. Radiology report, order exam, L-spine 2 or 3 views. Technique, ape, lateral, lumbosacral spot lateral graphs of the lumbar spine. History, fusion, comparison, lumbar spine radiograph 7/19/2022. Findings, unchanged L3 through S1 posterior spinal fusion with L5 through S1 intervertebral spacer and no evidence of hardware complication. Vacuum phenomenon at L2 through L3 without significant intervertebral disc space loss or spondylolisthesis. Unchanged laminectomies, no interval vertebral body height loss, similar apex right thoracolumbar curvature, cholecystectomy clips, impression, unchanged L3 through S1 spinal fusion. Let's look at the views. AP, lateral, lumbosacral spot lateral, that's a total of 3 views. This qualifies for CPT code 72100, radiologic examination, spine, lumbosacral, 2 or 3 views. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, unchanged L3 through S1 posterior spinal fusion, and no evidence of hardware complication. The fusion is intact, stable, and postoperative hardware is still present and functioning as expected. No signs of loosening, displacement, or failure. Prior decompression surgery, but no acute change or complication. The most appropriate ICD-10 CM codes are M43.26, fusion of spine, lumbar region, and Z98.1, arthrodesis status. The correct codes for this report are 72100, radiologic examination, spine, lumbosacral, 2 or 3 views, M43.26, fusion of spine, lumbar region, and Z98.1, arthrodesis status. Radiology report, order exam, L-spine 4 or 5 views, header, images, AP, lateral, lumbosacral spot, lateral, Ferguson radiographs of the lumbar spine, history, injury, comparison, radius 12/30/2022, CT 12/29/2022, findings, redemonstrated anterior superior end plate compression fractures at L2 and L4. Height loss is mildly increased from prior. The left L1 through L4 transverse process fractures are unchanged. No spondylolisthesis. Similar degenerative changes. L5 through S1 degenerative disc disease. Impression, mildly increased height loss of L2 and L4 superior end plate fractures since 12/30/2022. unchanged alignment of left L1 through L4 transverse process fractures. Let's look at the views. AP, lateral, lumbosacral spot, lateral, Ferguson. That's a total of 4 views. This qualifies for CPT code 72110. Radiologic examination, spine, lumbosacral, minimum of 4 views. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, the exam is a 4 to 5 view lumbar spine series ordered for a history of injury. The imaging redemonstrates anterior superior end plate compression fractures at L2 and L4 with mildly increased height loss since the last exam. There are also unchanged transverse process fractures on the left side from L1 through L4. Degenerative disc disease is noted at L5 through S1, but no new spondylolisthesis or vertebral height loss elsewhere. This is clearly a follow-up study, not the first time the fractures were seen. Because prior imaging is referenced, and the fractures are described as unchanged or healing, we'll use the 7th character D, indicating a subsequent encounter for fracture with routine healing. The most appropriate ICD-10-CM codes are, first, for the compression fractures, S 32.012D, wedge compression fracture of the second lumbar vertebra, subsequent encounter, and S 32.014D, wedge compression fracture of the fourth lumbar vertebra, subsequent encounter. For the transverse process fractures, L1 through L4, use ICD-10 codes from the other fracture category for each lumbar fracture. The correct code for this report are 72110. Radiologic examination, spine, lumbosacral, minimum of 4 views. Wedge compression fracture of the second lumbar vertebra, subsequent encounter. Wedge compression fracture of the fourth lumbar vertebra, subsequent encounter. Other fracture of first lumbar vertebra. Other fracture of second lumbar vertebra, other fracture of third lumbar vertebra, other fracture of fourth lumbar vertebra, subsequent encounter for fracture with routine healing. Radiology report, ORT exam, L spine complete. Images AP, lateral, neutral, flexion, extension, bilateral, oblique, lumbosacral spot, lateral radiographs of the lumbar spine. History, chronic pain, no injury. Comparison, outside MRI from 2/13/2023. Findings, grade 1 anterolisthesis of L4 through L5 does not change significantly with flexion and extension. Degenerative lumbar spine changes include mild disc space height loss and end plate degenerative changes, spinous process abutment and degenerative changes, facet arthropathy and hypertrophy. Stenosis is better shown on the MRI. Atherosclerotic calcifications, abdominal calcifications and surgical material. Impression. Degenerative lumbar spine changes with stenosis are better shown on the MR. There is relatively severe facet arthropathy. Anterolisthesis of L4 through L5 does not significantly change. Let's look at the views. AP, lateral, neutral, flexion, extension, bilateral oblique, lumbosacral spot lateral. That's a total of 7 views. This qualifies for CPT code 72114. Radiologic examination, spine, lumbosacral, complete including bending views, a minimum of 6 views. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. This is a multi-view lumbar spine X-ray, including flexion and extension views. The history is chronic pain, and the comparison is an outside MRI from February 13, 2023. There is grade 1 anterolisthesis of L4 on L5, which does not change with movement. Degenerative lumbar spine changes are present, including disc space narrowing, end plate sclerosis, facet arthropathy, and hypertrophy. Spinous process abutment. The report also notes spinal stenosis, better seen on MRI. There are also vascular and abdominal calcifications and some surgical material, which are incidental. Since this exam is being performed for chronic lumbar spine pain and shows degenerative findings, we'll select diagnosis codes that reflect these structural conditions, not trauma since no injury is documented. M43.16, spondylolisthesis, lumbar region. This describes the L4 on L5 anterolisthesis. M47.816, spondylosis without myelopathy or radiculopathy, lumbar region. This covers the degenerative spine changes and facet arthropathy. M48.06, spinal stenosis, lumbar region. While better seen on MRI, it's still mentioned here and part of the clinical picture. The correct codes for this report are 72114 Radiologic Examination Spine Lumbosacral Complete, including bending views, a minimum of 6 views. M43.16 Spondylolisthesis, lumbar region. M47.816 Spondylosis without myelopathy or radiculopathy, lumbar region. M48.06 Spinal stenosis, lumbar region. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.